Hello, everybody. This is Brian Devine from Top Line Management, and today I'm very happy to have with us Dr. George Gatseos from Safe Dental Services, LLC, and we're going to be talking about dental infection control. So first things first, Dr. Gatseos, thanks so much for joining us today.
Thank you so much, Brian, for having this available.
Absolutely. Glad to do it. Let's jump right in. I always like to start with having you tell us a little bit about yourself.
All right. In a capsule, I'm a practicing dentist, retired now. I was a full associate professor at the University of Colorado School of Dental Medicine. I was the infection control officer of the school at 250 operatories and central sterilization for the last 14 years. Prior to that, I had my own dental practice, general dental practice, for 17 years, so I know what it's like to be in the trenches and deal with OSHA regulations in the office and business environment. And prior to that, I'm a retired lieutenant colonel in the United States Army Dental Corps and was a clinic officer of several dental clinics in the United States Army Dental Corps.
Okay, so you've done a little bit.
Three areas in dentistry.
All right, very impressive. Let's talk more about the infection control side of what you do. What should all dentists know about infection control?
That's a great question, Brian, and I'm glad you asked that, because the bottom line in dental infection control is if you follow strict guidelines and the CDC guidelines, infection control works in dental offices. There hasn't been, with proper infection control compliance, there hasn't been transmission of disease since the early 1980s and the HIV/AIDS scare. And so we know that the present 2013 CDC guidelines work.
Excellent. So I'm going to bring this back to sort of my background from working in hospitals and training teams on how to do infection control. Is hand washing as important as I remember?
Brian, hand washing is the #1 prevention of infection control and transmission of disease in healthcare facilities. We've seen a huge increase in hospitals with the alcohol-based hand rubs, but washing your hands is the #1 paramount principle in preventing disease and infection.
Okay, so something so simple but still so important.
Yes, Brian, and it's real mundane and tedious, but if it's not done well and proper, we don't have protection.
Okay, very good. Now, we expect to talk a little bit about OSHA training here, so for those of you that are watching, let's make sure we cover that. For OSHA training for dental offices, what does that involve?
Well, of course, OSHA is involved with the safety of your employees in your office, and so their concerns are two main concerns. They have the bloodborne pathogen standard and the HAZCOM, the Hazards Communication Standards. So OSHA training related to those two standards is critically important in your office, that you are compliant with the guidelines.
All right, so tell me a little bit more about compliance. I know you've got a phrase that sticks with everybody.
Yeah, we can have all the policies, all the guidelines, everything in place, all your exposure control manuals perfectly written, but in the end, we have to do what we say we're going to do. And I like a saying that says, we know what to do, we just have to do what we know. So compliance is critical, and whenever you're dealing with compliance, you're dealing with the human element. And so breaches and breakdowns in dental office infection control is usually from a human breakdown area.
Now, let's talk a little bit about breaches. You just brought that up. What is someone supposed to do when there is, or if there is, a breach?
It's critical that #1, you don't panic. #2, you be honest. You treat people as people, and you present the factual situation. You don't panic. It's important to know that if you have an exposure in the dental office, that's not totally consistent that you'll always have disease. That depends on host resistance factors, the person, and the pathogen of the exposure. So But what's most important is that you take action, and immediate action, and that you take care of your staff, take care of them, inform them of the problem, and get them to the necessary professionals that can help, such as infectious disease physicians that specialize in infection control and infections, and get proper testing. We now have rapid testing for hepatitis C and HIV testing, and it's important that we do the right thing and communicate that. And then, of course, if you do have a breach, we want to look at the administrative controls and the other factors involved in that breach and say, what do we need to change in our office or in our procedures so that we don't have this happen again.
Perfect. And that leads us nicely into my last question here. At Safe Dental Services, what do you offer your clients?
I think it's important to offer a smorgasbord and a buffet of training and education. We have full capability. We can come to your office directly, do observation. I don't like to call them office audits. One office that we're working with called it a mock inspection from OSHA. I'm not going to say I'm going to do that. But what we want to review is your exposure control manuals, your policies, and then we want to observe. My wife Janet is an expert. She's been a registered dental hygienist for a number of years, and she and I will come into your office and review for 4 hours during a working environment all of your procedures. We'll give you a full report that day at the end of that session, and we'll see if you're compliant, if you're doing what you say you're doing. We will also offer classes, group classes, and that's in a little less maybe threatening environment, and sometimes that's more convenient. We can also do standards of practice consulting. So we have a wide variety of services. Our goal and our #1 intention is to have you conduct your clinical practices with excellence and have complete safety for your patients, your staff, and yourself. Because the bottom line in dental infection control compliance is it's for your safety. You don't want to have disease taken home to your loved ones, your family. So we want to have dentistry and the dental profession remain in a safe environment for the benefit of all.
Wonderful. So for those of you that have watched this hangout with us today, get in touch with Safe Dental Services. Give them a call at 303-746-4812. Again, that's 303-746-4812. Find out what's going to be just right for you, for your office, or go to their website at safedentalservices.com. Again, that's safedentalservices.com, and check everything out there, and you can even sign up for any of the upcoming events right there on the website. That's it for us. Dr. Gatseos, thank you so much for taking the time to talk with us today.
Thank you, Brian, and I assure you we will make your training fun.
Awesome. Fantastic. All right, that's it for us, everybody. Bye for now.